Thanks, Dr. Arnold, for the opportunity to join with the Minister in opening this very, very important conference today. I'll beg your indulgence. I won't go through the list of acknowledgements. They've been well listed already. But to acknowledge one very, very special group of people who I've come in the very short time I've been in the job to respect greatly. And those are the people with lived experience of mental illness. And they've had a tremendous impact on me just in the short time I've been here, and I look forward to working with them going forward. I also acknowledge that we meet on the land of the Kaurna people today and that we respect their spiritual relationship to the country. In 2014, the St Vincent de Paul Society's submission to the inquiry into affordable housing stated that housing is a basic human right that should never be just a matter of luck. In other words, everyone should have a place to call home. Yet you don't have to look too far on a bitterly cold Adelaide night to see that home for hundreds of people is staking a claim on a sheltered city or suburban street with their blankets and modest worldly possessions. Everyone here will agree that homelessness and indeed mental illness do not occur in a vacuum. There's not one cause and certainly not one solution, and statistics on the connection between mental illness and homelessness vary widely. What is clear is that there are too many people without safe, secure homes, many as a result of mental illness in South Australian metropolitan and regional areas. People may be homeless because they have a mental illness or a disability. They may have suffered complex traumas, social isolation and discrimination, or be escaping domestic violence and family violence. The 2013 Mental Health and Homelessness Report, prepared for the New South Wales Mental Health Commission, states that up to 75% of homeless young people have some experience of mental illness, and a large number of people who sleep rough also have mental health issues. The St Vincent de Paul Society says that over 100,000 men, women and children are without a safe, permanent place to call home on any given night in Australia. The Society unequivocally states that many of the people it assists with housing issues are also experiencing psychological illness. Those with mental illness are at far greater risk of experiencing housing deprivation. It's truly a vicious and cruel cycle. Mental illness can lead to evictions, which can lead to couch surfing with many family and friends, inappropriate or temporary accommodation or rough sleeping, which in turn can cause mental health problems or make existing mental illness worse. Access to stable and secure housing, and for some people supported accommodation, is essential for improving people's mental health and for turning lives around. In many ways, the template for helping the homeless is the same that will be used by the newly established South Australian Mental Health Commission. It's the same because mental illness, like homelessness, is a community issue. It's not an individual issue. The Mental Health Commission's role is to strengthen the mental health of South Australians. Our key task is to lead the development of the state's new 5-year mental health plan and drive ongoing reform while championing the cause of people living with mental illness and their families and their carers. The Commission will undertake other special projects and initiatives, and in this context we are currently developing an action plan to ensure that people with basic personality disorder get the services they need so that they can lead the type of life we all expect to lead. At all times, people with lived experience of mental illness and their family and carers will be at the centre of the Commission's work. The Commission is uniquely placed to work in strong partnership with all stakeholders, including service providers, clinicians, academic institutions, non-government and government sectors, from housing, education, employment, justice and disability. The strength of the Commission is that its only agenda is to bring together the best experience, evidence and thinking to improve our mental health here in South Australia. I'm spending my time talking to people. I say I have 2 ears and 1 mouth for good reason. I'm there to listen and I'm there to learn, and I've learned a lot. And I still have a lot more people to meet and to talk to and listen to. I want South Australians to have a sense of ownership of the Mental Health Commission and the new mental health plan that we'll develop. So I've been in the job for a month now, and what have I learnt? Well, I've learnt that homelessness and indeed mental illness will not be solved by one person, by one party or by one government. I know that at some time in our lives, each of us will be touched by mental illness, and that homeless people are not an isolated group in society. And that homelessness is an important issue for the Mental Health Commission and South Australia's mental health plan. I strongly believe we need to listen more to people with lived experience of mental illness because they have a unique expertise and knowledge that must underpin the state's mental health plan. I know that mental illness is not just a health problem, but a whole of government and whole of community challenge, and that there needs to be more emphasis placed on prevention. And when we talk about mental illness, we shouldn't just talk about treatment. We should be talking about recovery and all that this means for people's lives. I know that in order to reduce the incidence of mental illness, we have to build up the resilience and well-being of all South Australians. And the Commission is supporting current government initiatives and will look closely at what else needs to be done in that area. So it's been an honour to have the opportunity to speak to you today. Before I finish, I'd like to ask for your support. The South Australian Mental Health Commission belongs to the community, and that means we belong to all of you here today. So I encourage you all to have a sense of ownership in the Commission and to join us on the journey to improving mental health for all South Australians. You can become involved by following the work on the Commission via our website, Facebook and Twitter. You can also register on our website to be part of the discussion and to receive updates on how to contribute to the mental health plan that we're about to develop. It's an exciting and a challenging time ahead, and I hope you will all be part of it. Thanks so much for allowing me to jointly open this conference today with the Minister, and I wish you a productive and beneficial conference today. So thanks very much.